Chris Blackwell. I am the Executive Director of Voice of Care. Voice of Care's mission is to equip the church to nurture people with disabilities and their caregivers in their walk with Christ. And I'm presenting an overview of what it is like to be welcoming and inclusive to people with disabilities. We also offer a full 8-hour training that gives you the capacity to really do ministry among people with disabilities. But this one is a short video that will help you be welcome, open, and inclusive to all people with disabilities. First, we want to talk about People First language. Kathy Snow developed this, and it really helps you know what to say. Because a disability descriptor is simply a medical diagnosis. People First language respectfully puts the person before the disability. And a person with a disability is more like people without disabilities than different. So you would say she uses a wheelchair instead of she's wheelchair bound. Or he has autism instead of he is autistic. She has a physical disability instead of saying quadriplegic or using the biblical term crippled. And children without disabilities instead of saying normal or healthy children. Because really, are there any normal children? Everyone has some sort of disability. What I'm going to do now is go over a broad range of disabilities you might find within your church, within your classroom, wherever you are doing ministry among people with disabilities. So first, let's talk about developmental disabilities. These disabilities usually present themselves before the age of 3. They delay the child's ability in the area of speech, language acquisition, and physical skills. Suggested accommodations are to keep activities structured and predictable and use as many visual cues as possible. Physical disabilities. Many people with physical disabilities, such as cerebral palsy, may not have any cognitive disabilities at all. They may be able to tell you exactly the best way to help them. People with speech impediments may be able to understand you, and the work is to be able to understand them. Some things you might want to do with them is to make sure that the facility is accessible for all those with mobility issues. Make sure the aisles are wide and that chairs and tables are placed so that they can get the wheelchair in. Allow extra time between transitions between your activities. Most of all, do not pretend to understand someone who has a speech impediment. Ask clarifying questions. Try to say it in a different way. Ask them maybe to write it down if they can, or show you the object. Down syndrome. This actually happens 1 in 800 births in America. That causes cognitive learning disabilities and some physical coordination problems. While generally they exhibit a very loving and happy attitude, they can easily become frustrated with activities and things outside of the routine. The autism spectrum disorder. Like the name, there's so much variance among people that it is even hard to make generalizations. What is true among all people with autism is that they learn, communicate, and process information in a very different way than the mainstream population. So suggested accommodations for this population would be, first, get all the information you can from their caregiver, because they are the best ones to know how to best care for their loved one. and how to set up a best learning environment. Redirection is the key to form a behavior intervention with a soft, firm voice in a lower pitch. Seems to help a lot. Of course, using visuals as communications can really help with that process too. I always recommend ignoring the non-disruptive behavior. The disruptive behaviors might be their subvocalizations. Some might grunt, or they might say a word over and over again, or they might have hand gestures or body movements. Those that don't bother your classroom, just ignore those. But the big thing is you may have to, with some of them, use hand-over-hand guidance and to help with their fine motor coordination. And let me demonstrate that. We're going to practice. I want you to be able to write your name on the paper. And so I know you have trouble holding the pencil. So let me put the pencil in your hand. And then we just close our hand over it. That steadies the hand. You can do the same with someone with cerebral palsy or someone that might have a shake. And if they need a little more, you can always put your hand under their elbow. But you're going to place your hand and let it make it comfortable. Relax. Let your hand relax. Now, your name is Lori, and that starts with an L. So we would put an L. And is it with an O or an A?
O.
Oh. And then an R. Is it a Y or an I?
It's an I.
It's an I. And so we would just, like I said, think. And maybe we're drawing something. We want to draw a cross. And so we just help them do a line down and a line across. And the big thing is let them have it to be their paper as much as possible. Is there something else you'd like to draw?
Happy face.
Happy face? All right. We'll draw a happy face. So that's how we help people with hand in hand, over hand. Now the other thing is we might want to keep it there if they are good with it, but if we think that they might misuse the pencil, then you might want to keep the pencil to yourself.
Okay.
But thanks for letting me demonstrate that. Some accommodations you might want to do with a person with Down syndrome is do a lot of repetition. That's a key aspect for their learning ability. Others is hands-on hand and concrete activity to reinforce the concepts. And of course, a slower pace and a quiet atmosphere is always helpful. Next, I want to talk about hearing impairments. It's important to find out if the hearing impairment is because of an aging or a birth defect, because the elderly may not have ever learned sign language and also may not actually have hearing aids. And of course, if the person is totally deaf, you'll want to hire an interpreter, because the person to communicate in sign language and to really make sure that that person can be fully included. If the person has a cochlear implant, they will have a modifying device. It's a box you wear around your neck that amplifies your voice straight to the implant behind the person's ear. Of course, do not shout, that does not help, but enunciate clearly. Try restating an idea in different words, because some letters are harder to understand than others. B, P, and T often look the same and sound the same to a person hard of hearing. Be aware of devices if they do have them and they're small children, that if they're running around, they won't notice that the device may get lost, may get put down somewhere. So be extra careful when a student of yours might have hearing devices. The visual impairment, though, is another difference, whether a person is totally blind or just has a visual impairment. Again, some of these visual impairments may come with it being elderly, such as macular degeneration. This population does not know Braille and is often very uncomfortable in navigating because the blindness has come on so suddenly. And they might not be able to use the normal cane that a blind person uses. Find out if you can have resources done in Braille, if that's applicable for the person. Otherwise, make large print, dark printing on light paper. Always, always ask the person their mobility. Make sure that the facility, again, has no walking hazards and is well lit. Something we're just becoming more aware of is a sensory integration disorders. These disorders usually have a component along with another disability, but sometimes they can occur separately. People with this disorder are unusually sensitive to noise, smell, or touch. A way to help them is to modify the activity to lessen that sensory impact. You might need to have rubber gloves available if you're doing a messy activity. Or you might need to have the sound blocking headphones if an activity is going to get loud. Many churches today are making a facility a perfume-free zone so that smells are not distracting to people. However, I'm finding that most of you will find behavioral and emotional disorders within the group of people that you are working with, and they're not going to be necessarily on a particular spectrum of disability, or might not even be aware too much that they have a disability. So first of all, you have to determine whether or not that negative behavior is normal for that age. For example, a temper tantrum is quite normal up to the age of 4, but a temper tantrum at the age of 10 or 12 might give you a clue that there is some behavioral disorder going on. Burping and other bodily noises are quite common of ages 6 to 8. Again, you would just ignore those type of behaviors. And of course, being bored is just plain common among junior high students. But a person may have a negative behavior due to a disability such as obsessive compulsive disorder, attention deficit disorder, or oppositional defiance disorder. These require a behavioral modification program. Best of all is to avoid power struggles whenever possible. Give a child or an adult 2 acceptable choices of behavior, such as participating appropriately or sitting in a quiet designated area. Always give an overview of the whole activity along with clearly stated behavioral expectations. Keep rules to a simple minimum. So, for example, I always say hands to self and mouth shut when someone else is talking. Those are clear ones. They can understand, they can follow. Always have a buddy ready to help a child who needs a movement break outside of the learning area. Most of all, I want you to realize that there is such joy in this ministry. People with disabilities have become very creative. They think outside of the box. Some of them have the best faith statements, and some of those best faith statements come from people who exhibit the worst negative behaviors. Bottom line, first of all, is safety first. Create an environment that has little obstacles and often a few sharp points as possible. Make it a contained space with adequate supervision. And then lavish the love of Jesus on everyone. Make sure that the one lesson that every person leaves is that they are of value to God, loved by God, and saved for all eternity.